What is CPR? Cardiopulmonary resuscitation. A cardiopulmonary resuscitation is an emergency procedure consisting of chest compressions, often combined with artificial ventilation in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person. What is rescue breathing? Rescue breathing is a type of first aid that's given to people who have stopped breathing. During rescue breathing, you blow air into a person's mouth to supply them with vital oxygen. Rescue breathing can be done alone or as a part of a cardiopulmonary resuscitation or CPR. What is the difference between rescue breathing and CPR? Rescue breathing is a type of first aid that's used if someone has stopped breathing but has pulse. Rescue breathing isn't the same as CPR. Rescue breathing has only breathing every 5 seconds for adults. CPR is done when a person isn't breathing and doesn't have pulse. It involves cycles of chest compressions and rescue breathing. These are the steps in performing CPR. Number 1. Check for Avp responsiveness. A. Check for alertness. V. If the patient is responsive to voice. P. If the patient is responsive to pain. U. If the patient is unresponsive. Number 2. If the patient is unresponsive, check for ABC. The airway, breathing, and circulation. Number 3. After checking the patient, if there is no pulse and no breathing, call for help, or if any bystander is there. Sugua siya to call for help and ask permission to the bystander that you will perform CPR. Number 4. After gaining consent from the bystander, perform necessary action. If no pulse, no breathing, perform 30 compressions with 5 cycles in 2 ventilations, each cycle within the span of 2 minutes. Compress 1 to 20, 1 to 9, cycle 1, give 2 ventilation after 30 compressions. Step 5. After the 5 cycles, check for breathing and circulation if there is still no pulse. No breathing, continue 5 cycles CPR again. If after 5 cycles there is already pulse but no breathing, then perform the rescue breathing.
Perform rescue breathing. 1, 1001, 1002, 1003. 1, 1001, 1002, 1003. 1, 1001, 1002, 1003. 1, 1002, 1003, 1004. 1, 1002, 1003, 1005. 1, 1002, 1003, 1004, 1006. 1, 1002, 1003, 1007.